Thanks, Palesa. Now it's day 2 of the South African AIDS conference, which is currently underway in Durban in KwaZulu-Natal. And today, Doctors Without Borders, or Médecins Sans Frontières, shared a success story regarding a community-based HIV/TB project in Eshowe in KwaZulu-Natal. And this is called the Bending the Curves project, which started in 2011. A follow-up report shows that the project initiated in the area achieved UNAIDS targets of 90-90-90, just 1 year ahead of the 2020 deadline. That is, 90% of the people living with HIV in Eshowe know their status. 94% of those were on antiretroviral treatment, and 95% of those had a suppressed viral load. To explain what this project is all about and what it all means, I'm now joined from Durban by Musa Ndlovu, who's Doctors Without Borders Deputy Field Coordinator. Thanks so much for joining us. Welcome to the program. And congratulations on this fine achievement. How did you do it?
Thank you very much for having me in your program. The way in which Bending the Curves project has been implemented by MSF in partnership with the Department of Health has a number of things that we think contributed to the success of the project. Which incorporates the way in which we worked with the stakeholders, traditional leadership, traditional health practitioners, the civil society organization, and the community at large. We cannot really fail to mention the good work that were done by the community health workers. In our project, they were known as the CHEPs, Community Health Agents, who were doing door-to-door in different communities in our catchment population, ensuring that everyone is able to access HIV counseling and testing. And all of those who were tested get referred to the health facilities for initiation. That's how it was started. And with the education and also ensuring that we do not leave aside the prevention aspect of things by ensuring that the condoms are made available everywhere in every corner. Our drivers are delivering it, and when there are community events, they are able to access the condoms. So the next step was to make sure that we find as many people as possible who are HIV positive. So that was a way of achieving the first 90, ensuring that we go to every corner through our door-to-door HIV counseling and testing, using our community health workers, and ensuring that we have the mobile one-stop shop, which is the MIS, where we were taking tents to the community for them to access testing. Also opening the fixed sites, the sites where the working class will, during their lunchtime, pop in and access HIV counseling and testing. And also in the afternoon when they knock off from work. Understanding very well that there were some communities that were left out. Like when we talk about the immigrants that are working in the farms, we had to start a program that addresses their needs as well by ensuring that at 2 o'clock we have staff members that services them as soon as they knock off from work, because they cannot access the health facilities in the late hours of the day.
Mr. Ndlovu, if I could just interrupt,
if
I can just interrupt a little bit there, just get a sense of, so 2011 is when you started the project. Perhaps you can assist by, if you knew what the level of the problem was. 90-90-90 was the target. Do you have any idea what the status was at that time in 2011, so we can get a sense of the improvement?
We were sitting around between 58 and 68 in the 390s.
Wow.
But because we were already implementing the program before the 1990 target was announced by the UNAIDS. So our strategy was taking that direction already. That is the reason why we were sitting at this kind of statistics.
All right. So
but after the implementation of the program, Hello?
Yeah, so this week we've been hearing quite a lot about people failing to get respect for disclosing their HIV status, and that this might discourage people from going to find out. And I just wonder how you've been able to encourage people to find out their status, given the A, the fear, and B, also, I guess, the stigma that might follow if somebody was to find out their status.
What worked best for us is the involvement of the community, not doing it for them, but doing it with them, ensuring that the traditional leadership is in the forefront of the education and awarenesses and the mobilization of the community. And also with an understanding that the vast majority of people in the rural areas very much rely on the traditional health practitioners. So by bringing them on board, it was one way of making sure that we reduce the stigma, we allow a situation where people are open and are talking about the issues around HIV and AIDS. And the delivery of HIV counseling and testing in the households, doing door-to-door through our community health workers, also opened a platform for the families to start engaging on the issues around HIV and trying to run away from looking at it as the taboo. So those kind of approaches assisted us a lot in terms of reaching out to the communities and the communities as well, seeing us as the people who are bringing help in terms of defeating HIV and AIDS.
All right, so you've got a proof of concept now in Eshowe. Is this something that you're going to use as a blueprint and perhaps roll out nationally?
For rolling out, that will be for the department to see what they take from the experience of the BTC, which is pending the CAVS project. Because what we wanted to show is that 90 can be achievable. I think, as you did mention from the beginning of the program, that we've achieved 90 for ensuring that people test and know their status, and we've achieved 94 for the people getting on treatment and being sustained on treatment. And we've got 95 for the people who took the treatment very well and ensuring that their viral load is suppressed. So I think that's where we can draw some kind of lessons and take it forward. But that is for the department, because now we've proven together with them that it can be taken anywhere. Look, we've been doing it in the rural area with some part of semi-urban. So that gives a balance that you can take this project to anywhere in South Africa and beyond, and it can be done. We can achieve the 90 nationally and beyond.
Musa Ndlovu, we're going to leave it there. Thank you very, very much indeed, and congratulations once again on this fine achievement with this Bending the Curves project in Eshowe in KwaZulu-Natal.